Good morning, everyone. Today I will be discussing the journal club topic titled The Influence of Experimental Bioactive Glass on Pulp Cells Behavior in Vitro, published in the Journal of Dental Materials with an impact factor of 4.7. Coming to the some terminologies that are used in this article to understand this article better. First one is 0NAMBG. It refers to a specially formulated zero sodium mesoporous bioactive glass composed of 75% silica, 15% calcium oxide, and 10% phosphorus pentoxide. This composition excludes sodium to increase porosity and surface area, enhancing bioactivity when used with dental pulp cells. Bioactive glass or BAG is a type of a material that releases therapeutic ions, enabling it to bond chemically with hard and soft tissues and stimulate tissue regeneration. In dentistry, it is commonly used to promote remineralization and pulp healing. Mesoporous describes a material structure containing pores between 2 to 50 nanometers in size. These pores greatly increase the material's surface area, allowing more effective ion exchange and interaction between cells. EISA, abbreviated as evaporation induced self assembly, it is a synthesis technique used to create ordered mesoporous materials. It plays a crucial role in shaping the nanostructure of bioactive glasses, improving their interaction with biological systems. D50 and D90 particle sizes are statistical measurements indicating particle size distribution. D50 means 50% of the particles are smaller than the value, while D90 indicates 90% are below the standard diameter. These matrices help standardize the preparation of particles for biomedical use. Coming to the novelty, aims, and objectives. The novelty of the study is that it introduces a sodium free mesoporous bioactive glass and uniquely compares the biological effects of its fine large particles on human dental pulp cells. It explores the role of particle size and surface area in enhancing pulp cell viability and mineralization. Aim to evaluate the cytocompatibility and the mineralization potential of the experimental nanoparticle developed on human dental pulp cells in vitro. Objectives to synthesize sodium free mesoporous bioactive glass with two distinct particle sizes, to assess the cytotoxicity and the metabolic activity of the human dental pulp cells exposed to this bioactive glass using Alamar blue and crystal violet assays, to evaluate mineralization via alizarin red S staining and ALP activity measurement, to examine the expression of the odontogenic markers DMP1 and osteopontin through immunofluorescence, to analyze cell morphology and adhesion using confocal scanning microscopy, to investigate the influence of particle size and surface characteristics on pulp cell response. Materials and methodology. Researchers synthesized sodium free mesoporous bioactive glass in two particle sizes using a salt gel method. Human dental pulp cells were cultured and treated with extracts of these particles in indirect contact. Cell viability, ALP activity, mineralization through alizarin red assay, and odontogenic marker expression such as DMP1 and osteopontin were assessed using standard in vitro assays and confocal microscopy. Human dental pulp cells were cultured for 4 to 7 weeks under the standard conditions at 37 degree in a humidified atmosphere with 5% CO2. They were grown in basal medium eagle supplemented with 10% fetal bovine serum, 1% vitamin C, 2% penicillin streptomycin, and 1% amphotericin B with medium changed every 2 days. Human dental pulp cells were cultured for 4 to 7 weeks until confluence was achieved and then seeded at 10 to the power 4 cells per ml for experiments. Cells were exposed to the extracts for 24 to 72 hours for viability assay, 7 days for ALP assay, and 14 days for mineralization under standard 37 degrees centigrade 5% CO2 conditions. Statistical analysis used was one-way ANOVA with post-hoc test to compare the effect of fine and large grain particle sizes on various parameters. Statistical analysis was performed on cell metabolic activity, cytotoxicity, ALP activity, and mineralization. The results showed significant increases in metabolic activity, ALP expression, and mineralization for both particle sizes compared to control, with large particles showing greater enhancement, particularly in extracellular ALP activity and calcium deposition. No significant cytotoxicity was observed in any group. Results: the bioactive glass particles were not toxic to the dental pulpal cells. Cells exposed to the particles showed better growth and activity, especially with large particles. Both fine and large particles helped the cells produce more ALP, which is a sign they were starting to form mineralized tissue. The cells also formed more calcium rich deposits, meaning the materials helped with tooth like mineral formation. The large particles led to a stronger effect because they had more surface area. The cells treated with the particles also showed healthy shapes and good attachment seen under a microscope. Special staining showed that the treated cells started to produce important proteins DMP1 and OPN involved in tooth repair and dentine formation. Strengths: in a tested new type of bioactive glass made without sodium, which showed great promise for dental use. The study compared two particle sizes of same material, helping to understand how surface area affects healing. It used human dental pulpal cells, which are indirectly relevant to the new dental treatments. Multiple tests were done to check the cell safety, activity, mineral formation, and protein expression, making the results reliable and complete. Advanced techniques like confocal microscopy and immunostaining gave strong visual proof of how the cells reacted. The materials were shown to be non-toxic and actually help the cells grow and make tooth-like minerals. The findings support the future use of these materials in safe regenerative dental treatments like pulp capping or adhesive fillers. Limitations: the study was done only in the lab in vitro and not tested in animals or humans, so real life effects are still unknown. The researcher focused only on the short term results up to 14 days, so long term effects were not evaluated. Only two odontogenic markers, DMP1 and OPN, were studied, while other important markers like DSPP or OCN were not assessed. The study did not compare the developed biomaterial with commercially materials like MTA or biodentine, which would show how well it performs clinically. Iron release over time was not deeply analyzed, which is important for understanding how the material works inside the body. The material's performance in resin based composites or adhesives was suggested but not actually stated. What type of study design it used? This was a basic laboratory based in vitro experimental study using human dental pulpal cells to assess the biocompatibility, mineralization potential, and odontogenic response to a newly developed bioactive glass material in two particle sizes. Study design checklist, clear objectives. Control group was significantly stated. Defined sample size source was done. replicates in sample size stated. Material characterization was thorough. Test concentration of 800 microgram per ml chosen based on preliminary screening. Blinding and randomization, no explicit mention was done. Statistical ANOVA's analysis was done. Use of positive or negative control, such as commercially pulp capping available agent, was included for comparison, was no mention. Multiple endpoints assessed, ethical approval number mentioned, and relevance to clinical practice. Discussed how the findings relate to the restorative and the pulp preservating therapies. Future directions: the material should be tested in vivo in animals or humans to confirm the safety and effectiveness in real biological environments. More long term studies should be done to understand how material supports healing over weeks or months. Additional odontogenic and mineralization markers such as DSPP, OCN, and RUNX2 could be studied to get a fuller picture of differentiation. The material can be tested as a filler in dental adhesives or pulp capping agents to evaluate its performance in actual dental procedures. Studies should compare the developed nanomaterial with commercial materials like MTA or biodentine. Further research can be done to explore drug loading or functionalization of the glass to enhance antibacterial or regenerative properties. Thank you so much.